evening to everyone. Thank you so much for attending tonight's event. I am Ruth Price Rollins, and I am the president of the Greater Cleveland Alumni Chapter of Delta Sigma Theta Sorority Incorporated. I welcome you to our webinar that is being hosted by our Physical and Mental Health and Social Action Committees. We hope that this provides you with information to make an informed decision for your health and the health of your loved ones. As a disclaimer, this webinar is intended to provide information based on what is factual and as current as possible. We do understand that information is rapidly evolving as it relates to COVID-19. Delta Sigma Theta Sorority is not providing medical advice, but we do encourage you to follow up with a healthcare provider for further discussion and decision making. I will now turn it over to Denise Rucker-Burton from our Social Action Committee to introduce our panelists, and again, welcome and good evening.
Thank you, SORA President, and thank all of you for joining in. I have the pleasure of introducing our panelists, starting with Dr. Lynn Milliner. Dr. Lynn Milliner is a pediatrician at Metro Health Hospital and the former medical director of Cleveland Department of Public Health. She is also currently the associate director of Express Care and Transitional Care. Dr. Milliner is a graduate of Case Western Reserve University School of Medicine, and she has supported the COVID-19 hotline and is on the front line every day, planning and implementing strategies to slow the spread of this virus. Dr. Milliner is also a member of the Greater Cleveland Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Our second panelist is Dr. Claude Jones. He is the president and chief executive officer of Care Alliance Health Center. In this role, he provides executive oversight and leadership in developing strategic focus in social determinants of health and health equity, strengthening public-private partnerships, increasing connection between public health and clinical medicine, and implementing an outcomes-driven approach to program policy and development. Our third panelist is Dr. Pauline Tarabu. She's the preventive medicine physician who has been part of the Cuyahoga County Public Health Physician Response Team. Dr. Tarabu worked in collaboration with the County Board of Health to respond to the local demands of the COVID-19 pandemic. These doctors, working in collaboration with the County Board of Health to respond to the local demands of the COVID-19 pandemic, have been valuable. I will first start off by sharing with you that in April of 2020, Delta Sigma Theta held its first community conversation on COVID-19. It is now January 2022, and this is our sixth community conversation about the virus. Our soror, Dr. Lynn Milliner, has been a constant speaker and expert, sharing valuable information to help the community make informed decisions. Soror Milliner, we sincerely thank you for sharing your expertise over and over again, but we must admit that we did not expect to be here 2 years later. So again, we turn to you to ask you to help us understand what we're seeing now. To that end, Dr. Milliner, can you please explain what Delta and Omicron variants are and why we are seeing them despite being vaccinated and boosted?
First, let me thank the committee, both Physical and Mental Health and Social Action, for the invitation. I couldn't agree with you more that 2 years later, I thought we would be much farther ahead. But to your point, I tell people to have a healthy respect for what COVID is and what COVID does. and understandably a reasonable amount of fear for what COVID does. So back 2 years ago when COVID first hit, we knew it was a virus, and we know viruses aren't necessarily living things, but they're very smart things. So COVID did its job. It does what it does, and that is to infect as many people as possible and make people as sick as possible. So when we developed the vaccine, COVID, as I explained to science people that aren't scientists, it gets very smart and it will do everything in its power to evade something that's trying to take it out. Our response to COVID and to protect ourselves from COVID is to develop a vaccine. And COVID's response to our vaccine is to develop a variant. So what the virus will do is change its makeup to avoid what we're trying to do to prevent you from being infected. So first there was the Delta variant. And as you know, with all variants, they tend to appear in other countries before they get to the US, but before we know it, they get to the US. I think Omicron was especially frightening because it got here so fast. You heard about it in Africa, and then it was in Europe, and then it was literally in the United States within a week. And Delta did not, appear that quickly. Delta was very contagious, but as contagious as Delta was, Omicron was, I just want to say Omicron was on speed, right? So Omicron infected much more people. It was much more contagious. And the reason why we had this surge this past Christmas, and it was the worst surge that we had ever had. It took us back to the initial days of COVID, right? So you had something that had decided to evade everything that we tried to throw at it and made sure it infected as many people as it could and as much people as it could, even despite having a vaccine. But as you well know, the vaccines were developed for initial COVID, not a Delta COVID, not an Omicron COVID. The good news about the vaccines, at the end of the day, whichever vaccine you chose to take, is that it prevents severe illness from COVID, prevents you from being hospitalized in the ICU with COVID, and heaven forbid, prevents you from dying from COVID. So yes, a lot of us got tagged even though we were vaccinated, even though we were boosted, but we are much, 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 much less sick had we not been vaccinated at all. And as you well know, and I'll wrap this up, the people that are taking up space in the emergency rooms and then the ICU beds are people that are not vaccinated. So in the height of that surge, if you had a heart attack or a stroke, there was a long line of unvaccinated, panicky COVID people in front of you, making access to care even more difficult. The numbers have started to come down, and that's good, but we can't take our foot off the gas to stress the importance of getting vaccinated and boosted. And yes, we're working on developing a vaccine that fights COVID, both variants, Delta and Omicron, but we still have a ways to go. And as you know, if we can't get you vaccinated initially, then the push to get you a booster and get you another vaccine, that it's an uphill climb. So we encourage you to have the conversations with your healthcare providers, come to meetings like this, and thank you all for taking time out of your busy schedules to have a conversation, because I think conversations are important, and I think getting the information is important. Thank you.
Okay, thank you for explaining, Dr. Milliner. So many people in Cuyahoga County were infected with COVID-19 in December 2021, with rates appear to peak this month. Dr. Terbu, can you explain what happened in Cuyahoga County with the increase in COVID-19 infection, and if we have or will we start to plateau?
Good evening. Thanks so much for inviting me. I'm going to share my screen because I think that seeing the pictures and the trends will help a lot. So I'm going to go ahead and share my screen. All right. The information that I'm showing you is available on the Cuyahoga County Board of Health COVID-19 dashboard. So if you just go to the Cuyahoga County Board of Health website, you can find this same information, and it's being updated all the time. Now, in Cuyahoga County, there are two jurisdictions for public health, and there are about 1.2 million people in all of Cuyahoga County. A little less than a third are in the city of Cleveland proper, and about a little more than 2/3 are outside of Cleveland, and that's the Cuyahoga County Board of Health. So I'm going to show you data. Sometimes it's for outside of Cleveland, sometimes it's for the whole of Cuyahoga County, but they look pretty similar. So here is what we call an epi curve. And what you see is starting way back at the beginning of the pandemic in March of 2020, all the way on the left side of the graph, you see it's not very tall, and that's the number of cases that were reported every single day in the CCBH jurisdiction. And as you see, there's this little hump here, and that was over the holidays last year. Okay, and then you go on, and as the fall comes, you see another little hump, and then you see this incredibly high spike. And that's the Omicron, that very, very high spike that's up to and over 3,000 cases per day, which is just such a huge number. Now, we count cases, but we also count other things to see how we're doing. And we look at what percentage of the medical beds are being used. That's at the top, the blue line, and you can see a large percent, but at the end of this is now January 2022, and you can see it's all the way up to the top red line. The next is pediatric beds in orange, and you can see we've had some peaks in that. The next gray down, those are the critical care beds. And again, you can see the highest proportion being used in recent weeks. And then at the bottom, the percentage of ventilators. And that was quite high at the beginning, and it has crept up again a little bit. Now, this curve looks a little bit different, and these are not cases, but these are deaths. And what you see is instead of the highest spike being over here during the Omicron, you see the highest spike being last year over the holidays. And that's while we have a lot of cases of Omicron, it hasn't been quite as deadly. However, it often happens that we don't learn about the deaths that have occurred until sometime later, and we have to sort of backfill this graph. So even though we don't have a lot of deaths reported in the last couple of weeks, it's likely that we will receive reports and this will go up somewhat. So this is a map of Cuyahoga County. So now we're talking about all of Cuyahoga County by zip code, and this is to give you a sense for where the cases are throughout the county. And the darker green means that there were more cases per population. And so if you look at the bottom left, it's darker green in some of these southeastern areas. But the last 2 weeks, it looks quite different. It looks lighter around in some of the areas of the city, and then quite dark here. So it's not, so the total cases, where they've been, where the most cases have been over the entire pandemic is a little bit different than what it's been just in the last couple of weeks. Now, another great source of information of where there have been cases is on the Ohio Department of Health website. And so all the way over on the left, I wanted to show you where the cases have been in the Omicron wave. So now you can see that it's Cuyahoga County, the area close to Columbus, and the area close to Cincinnati that are the darkest and have had the most cases. In the last 12 days, though, you see that Cuyahoga County is no longer that dark anymore. Okay, so I wanted to break that up a little bit. So before the new year, at the top right, you see that it was very dark in Cuyahoga County, and after the new year, less so. So what we can take away from this is that the Omicron wave came very early to Cuyahoga County, and it's kind of past its peak, and it's spreading down in other parts of Ohio now. Now, if you want to get into the real nitty-gritty of the numbers, you can take a look at this. I've copied in, starting in November, the cases, the hospitalizations, the ICU admissions, and you can see that they started in November at about 1,300 a day, went all the way up to over 1,300 a day, all the way up to 14,000. And now last week, just 2,300. So we really have had the peak come and gone already. Another great source of information is Case Western, in collaboration with the Cuyahoga County Board of Health as well, does modeling projections. So what I showed you is what we know already happened, and what these maps are predicting or forecasting what we think is going to happen. So starting up in the upper left-hand corner on December 20th, you saw this big flaring out here, and what it was saying was, oh, I'm sorry, I realized that I've got these switched around, but in the bottom right is the first one, November 15th. And what you could see is the cases were kind of flat, but the prediction was that they were going to go way up, and in fact, that's what happened. And then, sorry, in the upper right, we see upper left, now December, it also projected that it was going to go way up, and in fact, that's what happened. Moving on to January 6th, you see that the projection was down, and then January 13th down even further. So we are on that downslope of the Omicron wave. All right. And that's, I have some more information for later, but that's all I wanted to share about the local data. So let me end this slideshow here. All right, and stop sharing.
Thank you. That is some great detailed information. Thank you very much. Now that we understand what has been happening most recently, we want to understand the best way to protect ourselves. Dr. Jones, there has been much talk about vaccines, antibody infusions, and even oral medications for COVID-19. And I don't know if Dr. Jones is on yet, and if he is, please answer. If he isn't, I'm going to kick this question to either Dr. Tarabu or Dr. Milliner. But can you explain what the COVID-19 vaccine does and how it is different from new treatments for COVID-19? Is Dr. Jones on yet?
Okay. Dr. Tarabu, do you want to take that one? And if Dr. Jones doesn't come back, I can take his next question.
Oh, Dr. Milliner, go right ahead, please.
Okay, all right. So the next one looks equally interesting, but I try to keep it very simple. So, and ideally what vaccines are, and we've had them our entire lives in one form or another, is it sends a signal to your immune system to fight off a foreign invader, right? So I know there was a lot of talk about what's actually in the COVID vaccine, and that is, at its simplest, it's really three things: salt, sugar, and fat. So the salt, sugar, and fat part are the parts that hold the vaccine together. There is no DNA in it. There's no microchip in it. There's nothing that affects your cell phone or tracks you in it. It doesn't affect your fertility. You know, all of the misinformation, and I'm sure I could prolong it by saying everything that I've heard about what the vaccine has, but what it really does is send a signal to your immune system that there is something in here that shouldn't be here, so I'm going to recruit some soldiers to fight it. So when you had symptoms after you got your vaccine, whether it was a headache or fever or body aches or fatigue, it was not the virus being given to you to stimulate the virus. So there was nothing live in the vaccine. It was really just a manner of getting your immune system to respond to the virus, and that's what it does. The newer treatments that are out now are not necessarily cures for COVID vaccine, but they are ways to mitigate or lessen the symptoms and the duration of the disease. At the height of the surge, though, the monoclonal antibody treatments, while they seem to be readily available when everyone got COVID, or it seemed like everybody was getting COVID, then everybody was requesting treatments. So now we kind of come full circle with everything. Now that the peak, we hope, will be sustained, it's easier to get those treatments. The newer oral antivirals are important. They can shorten the duration of your COVID symptoms, but like all other things, they're new and the supply is very limited. And there are some important drug interactions, so it's really important that you do your research. They are available, but just in limited supply. And we hope, you know, just like testing and just like the vaccines, that this is only a temporary problem, but we hope that each step we learn as we go and we get more prepared to fight the virus as much as we can.
Okay, thank you for that response. We do have one question in the chat, and we're going to go ahead and read that question. But in moving forward, what we're going to do is leave the question for the audience, that section for the end. But right now, I want to ask Tamia if you could go ahead and read the question that's in the chat right now.
Sure. This question is from Essence. I think it's Essence Douce. After you have had and recovered from COVID, is there a period of time that you have immunity from the virus? And if you do have any immunity, is it only from the variant you contracted?
That's an excellent question. So the first part of it is, yes, you do have some immunity once you have a COVID infection. What we don't know is how long that immunity lasts. We think it's anywhere from a few weeks to a few months. We also don't know, though, what variant you have, if it's just that variant or COVID in general. So as we get better at testing, I can tell you that some of the hospital systems were testing for variant-specific COVID. Not all of the hospital systems did. So people would call and say, well, which variant do I have? And we're not able to tell you. We can tell you that you've had COVID. But yes, you do have some lasting, temporary immunity from having the virus. I think that knowing that's made it complicated for people still to get vaccinated or boosted, because there is that presumption that if I've had it, what's the chance that I could get it again? Clearly, we know you can get it again if you've had it once before, but we encourage you that you should still protect yourself the best way you can, and that's to get vaccinated and boosted, because we do know that immunity will wear off at some point.
I can just add that when they look at who has the strongest antibody response, it's people who have gotten COVID and gotten vaccinated. So definitely get vaccinated after you have COVID, because that is really gonna shore up your immunity. Nothing is 100%, but if you want to hedge your bets, that's the best way to do it.
Thank you. Okay, so we'll get back to our scripted questions. As a nation and a community, we saw so many challenges with this most recent surge. Dr. Milliner again, there were many reports about children being impacted by the virus. As a pediatrician, can you explain reasons for this and provide or share any insights on how children can be better protected?
It's a great question. I would say initially, I think what we learned about COVID, and one of those is, what we know in the beginning is not what we know now. We clearly, for a time, didn't necessarily think that children were as severely affected from COVID if they got it. We thought they had a milder course, they're younger, their immune system is different, they fare pretty well. But as time went on, we realized that children can get as sick, right, from COVID as adults can, and certainly children with, chronic diseases, inheritable diseases, were equally as sick and just as likely to be hospitalized. The one piece that we also fail to address as much in kids is their mental health, right? So you have a whole population that can't go to school, can't hang out with friends, don't have their 16-year party, don't have high school graduations, don't have prom. People that started college in the time of COVID certainly didn't have the same experience that we have when we started college, right? And then on top of that, knowing that the vaccine to protect yourself against COVID was not initially available for children or even for young adults. So, and there was always that pushback that, if we couldn't get adults to take a vaccine that people considered, not tried or untrue or worried about it being safe, then it's a much different conversation when it comes to your children. Pretty much everybody on this call, without dating ourselves, when we were children, we got vaccinated and it wasn't a choice, right? You went to the doctor, you got your shots. You couldn't choose to say yes or no. I'm sure if you told your mother, I'm not getting that shot today, your mother had a conversation with the doctor out of the room and the doctor came back in and you got your shot, right? But we have now made so many things, however we do the decision process, there is a substantial number of children that are not vaccinated, right? Even though the vaccine is equally safe in children, it does prevent disease and severe disease, but we're having an equal, challenge. And there's still that misinformation that People don't get the vaccine because they're worried about their fertility. I run into a lot of grandparents and parents who are concerned that the vaccine will impair their child's fertility. That has been proven to be true. It's not an issue, but as you know, that information is very slow to be, corrected or improved. We haven't had the chance to do that. But at the end of the day, we just want people to remember that it's important for children to get vaccinated, especially if they're attending school. We can have a mask and distance, but so much. But we do want them protected so they can stay in school. And not just for the students, but for the teachers as well, for their parents, for their caregivers. It's important that we do everything we can to protect, every group in the lifespan, because that's the best way we're going to fight the virus.
Exactly. Thank you. Dr. Tarabu, back to you. Another challenge that we saw was a lack of tests being available to the public. Can you discuss what contributed to this shortage and any efforts that are being made at the county, state, and/or federal level to support testing?
Sure. Well, it really was and has been a supply and demand issue. So in terms of vaccines, it's while we don't know exactly who's willing to get vaccinated, we can kind of count the number of people in the country and figure out about how many vaccine doses we need to vaccinate everyone. But when it comes to testing, we don't know if someone's going to get tested 0 times or 10 times. So it's kind of hard to know exactly how many tests are going to be needed. And as we all know, we had PCR tests early on, and those were being done by hospitals, in the pharmacies, at the doctor's offices, etc. But then we also started to get the approval of some of these at-home tests. And there were a few approved. There are about 12 now, and 6 of them were approved, but the other 6 got approved just in the last couple of months of the fall. And so the test that was the most common test out there, the Abbott test, there was little demand. They even closed down one of their factories and one of their production lines because they weren't selling them, and they're only good for so long. And so there wasn't a lot of tests sitting there waiting to be shipped out. And all of a sudden there was a great demand with the Omicron variant. And, there are probably a lot of factors that go into that, but at that time, people were now no longer, not everything was remote. People were out in the world. And because of the availability of these tests, one of the ways to keep people in school, at work, was to get a test. And so all of a sudden, these tests were in great demand and they were hard to find. In terms of what's going on with them right now, well, the Ohio Department of Health, early in the Omicron wave, sent tests to the county health department and also to some of the federally qualified health centers. They gave them out to free to anyone who wanted them. The Kyoga County did the same, but they haven't received any tests for a while because now ODH is focusing on schools and some of the other counties. And I think people have seen that they're a little bit more available around. Right now, though, I want to make sure people know that, you've probably heard that the federal government will send you 4 free tests per household. And so you just have to go to covidtests.gov and you just put in your address information, and you should expect 4 free tests in the mail. I did it myself. I haven't received those 4 tests. I hear that there are some issues with the post office getting them delivered because, just like everyone else, they've had a lot of people out sick as well. So that's one thing. And also your insurance, if you have insurance, they will cover 8 tests as well. And so I think we're starting to catch up, and because there's less Omicron out there, I think people are finding it a little easier to get the tests. But those are the things that are going on right now. There isn't much from the county, but hopefully from the federal government and from ODH, there's some available if you need it.
Great, thank you. So I just wanted to announce that Dr. Jones will not be joining us. Unfortunately, he had an emergency, and so we will proceed as planned. But this next question will go to Dr. Milliner. Dr. Milliner, we have had COVID-19 vaccines available for about 1 year now, yet there are a number of people who still are not vaccinated. Can you discuss some of the reasons that people may choose to be unvaccinated and share how individuals who may want to be vaccinated, how they can do that in a way that's not burdensome?
Right. So I'll take the second part first because I think that's the easier one. I think when the vaccines first became available, as you know, there was probably a big outcry for them. And in the beginning, we didn't have enough vaccine to get everyone vaccinated, right? And then there was a lull where we had a lot of vaccine and couldn't get people back to the vaccines, right? So they were done in like mega sites or libraries or pharmacies. But if you have relatives that are homebound, how are they to get out and get to where the vaccine? So both the Cuyahoga County Department of Public Health, all of the federally qualified health centers, pharmacies have gone out, a number of ways to try to get vaccines to people. A lot of that had to do with the digital divide. So what we do encourage people now is, exhaust every possibility. Call your healthcare provider at a system if you don't have a healthcare provider. Contact the Cuyahoga County, Cleveland Department of Public Health. There are ways to get the vaccine to you if you choose to be vaccinated. The other part's a little more complicated. I've kind of always looked at this as I like to have conversations about why people get vaccinated. That's the easy part. The why not is very complicated. So certainly there is that fear of it's new, even though it's not really new. The technology that allowed us to develop the COVID vaccine has been around for really as much as 20, 30 years. What's newer is cutting the red tape to get the vaccine out to the people, right? So it was, mandated, and it was a federal emergency process. So where it appeared to get out to us fast, it was just the red tape that was cut, not the science behind developing the vaccine. That being said, there is so much information out there. Every day somebody tells me, I don't know who to believe, I don't know who to trust, right? So the issue has become very politicized, right? So if you're not, clear about where you can get information, please always have a conversation with a trusted healthcare professional who can cut through some of that. All of us have been on Facebook, we have relatives. The whole point about getting vaccinated at the end of the day is to prevent yourself from getting severe COVID. If you choose or decide not to get vaccinated, you don't get to choose the kind of COVID you get. So a lot of people will say, well, what's the worst that could happen to me? Young people, healthy people die of COVID every day. You can't sit back and say, I want door A where I don't get intubated in the ICU or dead from COVID, but you don't get to pick the COVID that you get, right? So there are things you can do in your power. So what we realize, and it's a gross overestimate of the numbers, there are probably a third of people that, chose to get the vaccination early. When it came out, they got it. And that was a lot testimony to our seniors who wanted to see other seniors and wanted to see their grandkids, right? So that population did very well. Then there's a third that are still waiting, right? They're like, oh, it's still too new. I'm still going to kind of hang out and see what happens to everybody else that got it before I get it. And there's still that last third we just haven't been able to move the needle as much about. You know what? I don't want to get it. My body, my choice, my prerogative. You can't make me get it. Certainly, as you know, the Supreme Court had to mandate it for healthcare workers, but didn't for large organizations. So it's still a very complicated issue. I don't, beat people over the head with, oh, you got to do it. My job is to say it's safe, it's effective. Let's talk about why you don't. I don't, try to win people to my side, or they don't try to convince me to their side, but it's an important conversation to have. And I think when we understand people's why not, we're in a better place to help them make better decisions that both they're comfortable with and their healthcare providers are comfortable with. We've seen too much death from COVID, and I'm sure everybody on this call has either been affected by someone with COVID or affected by a death of a loved one or a friend or a relative or, famous people. It's unfortunate for me that we buy into what famous people said, so, Nicki Minaj says, I need to wait for the research. I'm like, how much research more do you need to do? And do you research your physical enhancements as much as you research, what you're going to do to prevent a deadly illness. And the last thought I want to leave, sometimes I get some of my best sound bites by listening to the radio. It was very sobering and sad to me today to listen to the gentleman that needs the heart transplant, who is going to trust his doctors to put the heart of an unknown person to his body. They're going to open him up, take out the old heart, put in a new heart. He's going to trust them with his heart, but he will not trust a vaccine that could save his life. So he's chosen not to have a heart transplant because he won't get the vaccine and the hospital won't give him the heart unless he gets vaccinated. That's very sad, but that's where we are. So we gotta know why people won't get it, why they choose not to. And let's talk about that in safe spaces like this so we understand the why, so we can help everybody get vaccinated, so we can go back to what we consider what was normal before. I'm not sure some of us even remember what normal is, and you still have to be careful, right? So even if you're vaccinated, do modify some behavior, right? Or if you choose not to get vaccinated, certainly protect yourself and everyone that you come in contact with.
Well, that's great, great information. Thank you, Dr. Milliner. So we have about 10 minutes left, and I want to go back and ask Dr. Tarabu if you had any other information you wanted to share, either to piggyback on the answer or response that was just given by Dr. Milliner, or that were on your slides.
Thank you. Yeah, actually, I just happened to here. I'll share this. And thank you, because Dr. Milliner just highlighting that this is actually can you see it? The Kyoga County Board of Health COVID-19 vaccine data dashboard. So you see this graph. This is, again, another graph starting on the left, the beginning of the pandemic, and going to the right. And the blue is people getting the first dose. The orange is the second dose, and the green is that booster. So that's sort of a visual representation of what she just described so well, and that's what we're seeing now.
Very interesting. Thank you. All right. So we are almost at the end of our program, and we will now take some questions from the audience. I'm going to ask Tamia to help me here because I cannot see the chat. So if there are some questions in the chat, would you go ahead, Tamia, and read them, please?
Sure. Okay, this question says, I'm wondering if I contracted COVID during the initial months of 2020, what test, if any, might I request to determine my status?
Oh, so if I understand the question right, it sounds more like that's an antibody test question. So that's to see if you've had COVID or recovered from COVID. I'm not sure if the caller has additional information, or I'm not clear about the answer. Currently, testing to see if you've had it hasn't been widely available. I imagine that that's going to come. I think at the end of the day, if you tested, most of us, we've probably had it, whether we had symptoms or not, and we've probably recovered from it. That's always been a lofty goal, but that kind of testing is expensive. And we were doing it for research purposes in the beginning, and then it just never took off from that. So I imagine that technology will come. I just don't think it's available now. I did see one question in the chat before you get to everyone. It said something about getting the test in the mail. It is 4 tests, not 4 boxes of tests. So you get 4 to a household, and that would be, even if it's 2 in a box and you get 2 boxes, it's a total of 4.
Okay. Next question. Are the PCR COVID tests more reliable than the home rapid test? Why or why not?
I'm happy to take that. So what the PCR test does is it looks for the virus itself, and it looks for the exact sequence of the RNA to see if the virus is there. And so it can detect very, very, very tiny amounts of virus. It doesn't say if that virus is alive or whether you've gotten over your infection and your body is just getting rid of little broken up bits of virus. So it could be just dead virus that you're not going to pass to anyone. But the PCR test, it goes in and it can take a little teeny bit of it, and it amplifies it and can detect that. The at-home tests, most of them are what we call antigen tests. And so what it does is it looks for something that can bind to a part of the virus if it's there. So for one thing, it doesn't amplify it. It doesn't amplify it. So there's got to be enough of it to see it, to be able to bind to it and detect it in some way. And then the other part is it's not as precise because you're not actually looking for the sequence of the virus itself. You're just looking for something that can bind to it. And sometimes because of mutations in the virus and how it changes, it may not bind very tightly. So it may not always be able to identify a virus when it's there. And then it can't identify it if it's at a very low level because it doesn't amplify it before it goes to detect it.
Okay. What is the waiting period to receive a booster after being infected with COVID?
It's the same as it was in the beginning. As long as you're recovered, you're out of isolation, and you're feeling better, right there is no longer time now. That isolation is down to 5 days. But mostly we would recommend that as long as you are not in an immediate contagious period and your symptoms are improving and you feel better, that you should not wait to go ahead and get your booster. I know there's been confusion along the way because the CDC changes a lot. In the beginning, we said you had to wait 90 days before you could get the vaccine, but we've shortened that period because we do know that you have some immunity, but that's not permanent. So the sooner you get your booster or the initial or finish the series of a COVID vaccine, the better protected you are.
Okay. Why have we seen a delay with positive tests, although you may have symptoms? Uh-oh. Hold on. I lost it. I'm sorry. Why have we seen a delay with positive tests, although you may have symptoms? Do you think that contributed to the December spike?
I actually think it was more of a numbers thing. I think when there was such a demand for testing, so let's say, for example, you went to go to a pharmacy or a hospital system. When you used to be able to get results in a day, it was taking a couple days to get you scheduled, and then it was taking even longer to get the test results back, right? So by that point, you might have been out of isolation or very close to ending an isolation or quarantine period, whether you were symptomatic or not. But I think it was just like we had with vaccines and testing, the demand was so great, right? And Omicron was a much more contagious variant. So you're right, by the time you were trying to get tested, protect your family members, then the family members started getting sick and everybody around you started getting sick. So we would get to a point to say if one person in the house tested positive, everybody else in the house is guilty by association. And there was really not a need to test everyone, but it was really more supply and demand. And I think it was a perfect storm. So we didn't have enough tests to keep up, and then everybody really, it just spread like wildfire.
Do health officials foresee COVID vaccines being a yearly vaccine like the flu shot?
If Dr. Tarabu's down, I think Dr. Fauci addresses that all the time. We honestly don't know. We hope it would be like a flu shot because right now we're having to get boosters, right? So there are some countries that have introduced a fourth booster. Israel's always kind of on the forefront of what we're doing with vaccines. So as you know, it's a challenge to get people 2 shots. It's becoming a challenge to get 3. Heaven forbid we're talking about 4. But at the end of it, we would love for it to be like a yearly vaccine versus like every 3 month or every 6 month how it is now. But that's just because we don't know, and we don't know if we're going to get future variants. So the ideal situation would, yes, that it would just be a yearly thing and not a much more frequent than a yearly booster.
Okay. So I know you just touched on it, but I don't want to leave anybody out. The next question is, what is the likelihood that a 4th shot would be recommended for those that aren't?
I think that the study's being done now, and they think if it's going to be helpful, then we'll recommend it. I mean, as you know, everyone won't sign off for it, but and it's likely that if we get another variant, then we probably should get a fourth booster dose. But we really do hope that we can get it down to a yearly or every 6 months, or something that's much more manageable for the people that do decide to get vaccinated.
Okay. Can we expect that people who experience minimal symptoms or are asymptomatic will experience more severe symptoms if more variants develop? Will vaccination status make a difference?
I think we really don't know, because we don't. I think it depends on the virus, and it depends on the person, and and it depends on an interaction between the two. And so we don't know what variants may come up. And as we know, we're in this connected world. So a variant could come up and evolve in any part of the world and can make its way around. And there are some people who became very ill with one variant, but not with another. And so I think it's impossible to know what we can expect. But the more highly vaccinated you are, and hopefully the match between the vaccine and the variant will be good, then the more protected you're likely to be.
Denise, shall I keep going? How are we on time?
So we are right at 8 o'clock. I would say let's just take one more question, and then we can start wrapping up.
Okay, so the next question is it true that the symptoms of the Omicron variant are not as severe as the other variants? If so, why do you think that is?
That is true. We're not sure why. It could just be the variant. What Omicron did that was different from Delta, while the symptoms may not have been as severe, its ability to infect more people was much more dramatic than Delta was. So it's what viruses do. We can't really say why. And sometimes the symptoms are different. So I think with Delta, if I'm not mistaken, there was more the noticed change in sense of taste and smell that wasn't seen as much with Omicron. And people weren't as sick, but it really, you could have barely a whiff of a symptom and still able to spread Omicron, and that wasn't necessarily true for Delta. So not exactly sure why, except that that's what variants do, right? And as we try to predict what the next variant will do, to Dr. Tarabu's point, we just don't know. We're still, in the learning stages. So we hope that if there is another one, it won't be as severe or as contagious as the last one.
And when they did studies comparing the very first one, Alpha, to Delta, they found that there was a lot more virus in people's noses. Well, you went to Omicron, and a lot more virus was being produced in people's noses and throats. And so it was easy for them to spread it and get it out there. But it seemed that the Omicron didn't bind as well to the lungs. And so people got a little less sick. It stayed more, in their upper respiratory tract. And so they could spread it easily, but didn't as easily get down into their lungs.
Oh. Okay. Okay, thank you. I hear the bell ringing, so that's our sign. So I do want to just mention a couple of people before we close. Thank you all for attending. I do want to mention that our co-chair for Physical and Mental Health, Kalia Fisher-Grace, is on. And also, I'm not our co-chair, I'm sorry, our chair of Physical and Mental Health is on the call. And also the chair of our Social Action Committee, Meredith Turner, Councilwoman Meredith Turner, is on. I think she's waving. And also wanted to mention that Damalis Garcia, and if I am improperly pronouncing your name, let me know. But Damalis Garcia is also on the call. Damalis is the Community Outreach Manager at Carolines Healthcare Center, and she is the one who helped us secure Dr. Jones, who, again, unfortunately couldn't join us because of an emergency. Okay. All righty. Well, I want to thank everyone for attending tonight. Our community members are so important to us, as well as everyone else on the call. I also want to take this time to thank our esteemed panelists for your time. Again, we encourage each and every one of you to speak with your healthcare provider to help you make informed decisions about your health. We, again, thank you for attending and thank you for your time. Have a great evening.
Bye.
Thank you, everyone.